always told people to get involved not only with their specialty organization, but also with a larger organization. So I was very involved with the Society of Vascular Surgery because that's my organization. I participated as treasurer and then became president, presented my research there, and that's really when I was a division chief of vascular surgery at UCLA. Then I became chair of surgery at Johns Hopkins and actually became very involved with the American College of Surgeons. I had started becoming involved in 1983 as a resident, but then became a governor of the American College of Surgeons through the VA surgeons because I was very active with that society also because I worked in the VA system and became president of that society as well. And then I became a regent, which is one of the 20 people that really run the college, became chair of the board of regents. I was the first woman to do that. I did that for 2 years. And then following that, you are eligible to become president. So last year I was elected president-elect and this year I'm president. So thinking about what I could contribute with my talk, I thought about what we need to do to get on the other side of COVID-19. It's really been a long 18 to 20 months with us hoping that COVID would be gone, and it keeps coming back over and over again. So I equated it to how we get patients through surgery, where you actually start doing things to help them pre-surgery, such as exercise and eating well and making sure they're all set to go mentally for the surgery. And then post-operatively, again, getting them out and exercising and having them understand what they need to get better. And I gave 2 examples of how we do that in patients who have aneurysm repair or distal bypass repair. So working on that as how do we get on the other side of COVID as far as education, research, our mental health is really to have hope. Is to really look at what we can do as surgeons to give our patients, our colleagues, our students, everyone hope as we go forward. So we devised a hashtag called Surgeons Sowing Hope, SOWING, that we're hoping to use this year to have many of our leaders talk about things they're doing to help patients become hopeful about getting their interventions and getting on the other side of COVID, and also how to get our colleagues to be hopeful as we go forward. Last year, the president was Wayne Meredith, who happens to work here at Wake Forest Baptist Health too, and his all was about looking at resilience, and also he devised a racial equity task force. So we want to really work on diversifying those who become surgeons, and so looking at racial equity as well as increasing the number of women still into surgery. And we'll continue working very hard on that racial equity task force. There are grants that have been put out. Tim Emberline has run that group. So we'll continue to work on that. The other thing that Scott Levin did was to work on bringing in more subspecialty surgeons into the college and really focusing on those so that they know that there's information and things they can learn from the college, including vascular surgery, plastic surgery, colorectal surgery. So we'll look at that as well. So we'll continue the Racial Equity Task Force. We'll continue working with specialty groups as well. And then in the United States, we're really facing a huge challenge of pay cuts from the federal government for what we do. And so we're really working hard the next few months to make sure that these cuts do not occur. Many of the hospitals are struggling so because of COVID-19 and inability to do a lot of procedures, and also because patients are a little frightened to come to the hospital because of COVID-19. So having pay cuts in what they pay surgeons right now would be hard. We're also having a lot of staff shortages and people not working in hospitals right now. They say about 18% of healthcare workers have quit working. And so between the staff shortages as well as the decreased payments, patients could see a lack of access to surgery. So in the next few months, we'll be working hard on to block the pay cuts for the surgeons in the United States, and then continue to show our value in what a surgeon means to individuals that need to have life-saving surgery.